My name is Miranda Hagerman, and I am a registered nurse on the medical surgical floor of Comanche County Memorial Hospital in Lawton, Oklahoma. Do you guys remember back when you were in your young teenage years and thought you knew everything, just wanted the grown-ups in your life to treat you like grown-ups and let you make your own decisions? Granted, those decisions we wanted to be able to make were probably things like going out with our friends when we wanted, deciding our own curfews and going out to those parties that we really knew were recipes for disaster. Well, what I'm going to be talking about deals with something a little different. It deals with adolescents being able to make their own decisions, but in this case, deciding if they should be able to sign consent to participate in research studies. I'm presenting to you the ethical topic and issue regarding adolescents being able to consent to participate in medical research. I selected the topic of adolescents being able to consent to participate in medical research because it is an imperative debate in the nursing world at this time and has been for decades. According to an article in Child Care, Health and Development, there is a growing impetus across the research, policy, and practice communities for children and young people to participate in decisions that affect their lives. The current dispute between those for and those against adolescents to being able to participate in medical research is significant in that patient advocacy as well as patient safety are both being protected and addressed, both of which are major factors in the healthcare system today. As a nurse, I am aware that an issue debating things like patient safety and care, better research outcomes, and adequate decision-making capacity plays a major role in medical research. That is why it is not only important to me, but is an essential issue to all those and staff in medical research. There is always room for improvement in any field of medicine, including the medical research field, since the basis of this field is to find research for the improvement of health, medications, and procedures. It seems as though any opportunity to increase outcomes in research would seem valuable. According to an article of the Journal of Law, Medicine, and Ethics, children are defined as those who have not yet attained the legal age for consent to treatments or procedures involved in the research, and usually, as we have seen, are under 18 under state law. So, in most states and under most federal law, those under the age of 18 cannot consent themselves to participate in research studies. Also, in that same article, it is pointed out that policymakers need to consider the nature of decisions being made, developmental factors, and the risks and benefits of allowing teens to make their own decisions. This brings up the issue of patient autonomy as well as patient safety, non-maleficence, which is to do no harm, and beneficence, which is to do what is best for that patient. In order to protect adolescents from harm, and sometimes harm that they bring themselves, both state and federal laws in the United States have been put into place regarding consent. In an article of the Journal of Law, Medicine, and Ethics, parental consent requirements in the United States are based in constitutional law, which is reinforced in statutory and regulatory law. Should adolescents be able to consent to participate in medical research? That is the ethical debate I am presenting to you today. The Child Care, Health and Development Journal used a study consisting of 151 looked after adolescents between the ages of 10 and 23 years. 52 were male and 81 were female, and 18 did not provide any gender information. These patients were given questionnaire packets which included content to test their abilities in different decision-making fields such as interpreting information, predicting consequences, alternative weighing, decision follow-through, and defining importance of those decisions. Of the young people that were tested, 113 out of the 151 were given advocacy. In that same article, it is stated that a growing body of research reflects that the fact that participation in decision-making, whether in education, health, or social services, has beneficial developmental effects. Recent school research has highlighted the participation in decision-making can lead to developmental benefits in relation to self-esteem, cognitive abilities, and social skills, as well as respect for others. When involvement in decision-making was less evident, the same research showed that effects of health outcomes were likely to be negative, including feelings of helplessness and lower levels of confidence. An article of the Journal of Law, Medicine, and Ethics argues for adolescents to be able to consent to medical research and points out that the current line separating young adults from children is the wrong line with regard to decisions to participate in IRB-approved human research. In fact, most recent psychology research suggests that starting at about 13 or 14, teens are as well equipped to make these kinds of decisions as those 19, 20, or 21. Adolescents being able to consent to medical research is also supported in that article, pointing out that not only should those over 14 be able to participate in research involving human subjects and make their own decisions, but that they should be treated like adults for all healthcare decision making. Those that are against adolescents being able to consent to medical research, such as Hastings Center report, argues that adolescents consenting is not a question of their capacity to make sound decisions, but that they should not have the authority since they are simply not adults, no matter if they have the decision-making capacity or not. It is stated that extracting healthcare decision-making from the normal context of family decisions is disruptive to the natural protective role of a parental authority. And that another reason adolescents should not be able to make their own decisions is that legally and ethically, they are not expected to be responsible for themselves. Others that are against adolescent patients making their own medical decisions provides different arguments as to why they should not be able to consent. In an article from the Journal of Issues in Law and Medicine, one of their main arguments is just that the adolescent brain is completely immature. It is stated that every area of the adolescent brain is immature and the neurotransmitters are overly active, and it is extremely difficult to argue that adolescents are capable of independent medical decision-making without a parental involvement, as well as because the adolescent brain is so immature, the parent must become the teen's brain, providing assistance with problem-solving, interpretation of events, things like judgment, danger protection, and virtually really all other areas of life. In the United States today, 36 out of 50 states always require parental consent to be given for any person under the age of 18 to participate in any medical care or research. According to the Hastings Center article, 14 states have adopted varying versions of a statute of law called the mature minor exception. This states that adolescents, depending on the state, would be considered a mature minor for a plethora of reasons and be able to make their own decisions regarding medical care and research. Some example of these instances in which minors would be considered mature minors and make their own medical decisions would be graduation from high school in Montana for those that are not yet 18 but they have graduated. The age of 14 or older in Alabama lets you be able to make your own medical decisions. Even Louisiana allows any minor to consent to any treatment or research that he or she believes is necessary. In conclusion, I believe that each side of this debate topic has reasonable points. It is important that each state and facility conducting medical research on adolescents weigh the benefits versus the detriments to patients in order to come to the conclusion as to why, or even if they should adopt laws to either allow adolescents to consent for themselves or not. Thank you.